Alright, so final video for this week is about shoulder taping and wrapping. So the shoulder is very unique. We talked about that, right? We know there are many components that go into shoulder motion and shoulder limitations. But what I want to talk about is what you might encounter when it comes to wrapping or taping or some things I've found beneficial in my clinical practice. So the first one is a sling, right? We have a patient who is suspected, maybe it's a fracture or a significant injury that's causing them a lot of pain. Maybe they're post-surgical and we're putting them in the sling. So the sling that you're going to see on the left side of your screen, that sling is kind of our basic. They're in kind of an internal rotation. And this is probably what you have in your preceptor might have in their athletic training kit. So it's the basics. You would not want to put somebody who is post-surgical in a sling like this for very long. But there are reasons why you would use it. Specifically, if we're looking at a wrist elbow injury, they're probably okay in the sling for a short period of time, making sure that it's important to make sure that the hand is not below the elbow and that you have at least flexed to 90 degrees, if not a little more, because if there is any swelling going on in the arm or the forearm, then it will start to drain down towards the hand. So you have to kind of focus and be cognizant of that. Then the picture on the right is one that has them propped up off their body. It keeps a better posture, promotes less anterior rotation with the shoulder joint, right? A less of a hunched and closed front. It appears that it has some kind of grip strength mechanism on it, which allows for the patient to continue to work on their hand, their forearm, in case any swelling gets down there, but it moves it off the body. Now, there are other options when it comes to slings. Often they've started to put patients in more of an externally rotated position in order to promote like any scarring that could happen on the anterior shoulder and in that anterior capsule. So it's important that you consider this for what your patient might need and what their injury is, and have an open conversation with the physician. If they're just putting them in a basic sling, then you could probably provide them with that would help better promote general health while they're dealing with their injury. Now, I put on here a step-by-step process on how to fit a sling if you do not have a normal sling, right? If all we have is an ACE wrap, this is what we're going to do. And you might be in this position if you've had a dislocation, you're on the road, you don't have a sling, the team you're visiting doesn't have a sling. This could be an option. And the big thing here is looking at and making sure that the hand is above the elbow like that, so no swelling moves into the hand, and then you have a much bigger issue with some lymphatic drainage. The next one, and you can go ahead and watch this video. I'm not going to play it, but it's how to make a sling. It also walks you through the process. This is going to be specifically this one for if you have a broken clavicle, right? Those patients you do need to immobilize before you refer, just to make sure there's no extra movement. Because think about if a clavicle were to get displaced, a lot of structures could be affected. So this is more of the emergency care approach. The next is our shoulder spica. You might have learned about a hip spica by now, but this is particularly for the shoulder if you're having some just instability, if you have a patient who doesn't need a lot of range of motion in their shoulder, football players, maybe on a non-dominant basketball player, but that they've had some issues, and this provides a stability, a kinesthetic feedback that makes them feel a little better, some of that compression, right? So on the left we have the DonJoy, or fill in the blank, a number of brands that produce one, or you can make one yourself with a ACE wrap, and this ACE wrap will function much like the hip spica. You're going to go across the body, and then depending on what you're promoting, you're going to wrap around the arm and then alternate around the arm and across the body. Making sure that you're getting over the AC joint is really important, because if it gets down too low, it won't be as effective. Like I kind of talked about, here's some different immobilizations that are available. You see the one on the left is definitely getting them into more motion, right? Getting the arm away from the body, promoting that. It is even a hinge brace, so you could allow them for more movement and promoting better posture. Same with the one on the right, just gets them away from the body and their chest up, rather than what another, our traditional slings might bring you down and forward shoulders and just kind of that anteriorly flexed position. So both of these are good options for if somebody's going to be in a sling for long term, or post-surgicals for the most part. Okay, lastly, I want to talk about different ways we can help tape for scapular dyskinesis. Talked about this a little bit in the last video about what scapular dyskinesis is, and it's that lack of symmetrical movement or proper movement for the patient. But with any upper extremity athlete, or any athlete at all, you might have some of your patients that have bad posture, they have dyskinesis, and you can provide some of this, some of these taping jobs to help them understand what this position is supposed to be, right? So I think upper thoracic, cervical posture is our hardest, right? People understand their hips, but it's sometimes hard to get your thoracic spine in the right position, and they might not understand. So this technique using Leukotape can be a good tool to help reinforce some of the training you might be providing them. So what you're going to do is, and depending on the type of patient, when I was working swim, I did not use any of the coverall, but you can place a strip of coverall in the position and then the Leukotape on top using some spray, but just depending on how sweaty the person is. If they're getting in the water, right, you're going to need more sticks, so the Leukotape goes straight on the skin. But you're going to have them get in the right posture, and then you're going to go from the middle third of the clavicle all the way down to T12 without crossing the spine. So this hits right down the center of the scapula and hopes to provide them that feedback. So if you apply it with good posture, then when they start to slump forward, they'll feel the feedback and sit up straight. It's like being there to, being in their ear while you aren't actually sitting next to them in class or in any other situations, maybe at practice. So this is a good way to do it. There's another way using kinesiotape or rock tape or any version of our movement tapes that can assist with similar things. So there's some stats here. This comes from an article that discusses its effect on the degrees of motion once applied, but for the most part, and what you need to understand is it's very similar to the other one, right? It's going to provide that kinesthetic feedback. It lifts the skin, and so once you start to move forward, or you feel the patient feels as though they're getting out of posture, they'll get immediate feedback from the tape. So that's how I've used it the most. There are definitely other ways, and I've posted some videos up on the Blackboard site to kind of go over some of these, how to apply them the way it makes sense. With the KT tape and the Leukotape, they're very similar applications, just a different type of tape, and sometimes a little bit different goals. The Leukotape is going to provide way more feedback, where the kinesiotape might be better for people moving a lot and going through a lot of ranges of motion. So let me know if you have any questions. If I can demonstrate these any better, please come by. We can talk about it. And I can't wait to hear about your guys' assignments and some of the questions that you got answered this week. Thank you so much. We'll talk to you soon.